Today our group is going to be talking about hyperthyroidism. We are teaching this to women because they are more likely as they increase in age to develop this disease than anyone else is. First, we are going to teach you about the pathophysiology of hyperthyroidism. Pathophysiology is the changes that go along with a particular disease. The word hyperthyroidism can be split up to show its meaning. Hyper being that there is too much, and thyroid referring to thyroid hormone. So essentially, the thyroid gland creates too much thyroid hormone, and this is what causes hyperthyroidism to occur. The thyroid gland is a butterfly-shaped gland that sits low on your neck, as seen in the picture. The brain will detect low levels of thyroid hormone in your blood. Once the body notices the low levels, thyroid-stimulating hormone, or TSH, is then activated. Thyroid-stimulating hormone does exactly what the name says. It tells the thyroid gland to produce more hormones, and in this case it is T3 and T4. T3 is triiodothyronine and T4 is thyroxine, which are the two main hormones produced by the thyroid gland. The full names of these hormones are not as important to be remembered because they will often be referred to as T3 and T4. The gland continues to grow larger and produce more thyroid hormones. Overproduction causes the body to stop producing these hormones. The body then senses a loss and wants to continue to produce more hormones. The gland will then swell because it is full of T3 and T4. T3 mainly functions to speed up metabolism in the body. Hyperthyroidism essentially equals hypermetabolism, too much metabolism. As women, you will start to notice changes in yourself, such as weight loss, heat intolerance, rapid heart rate, and hyperactivity, where your body is constantly moving. These signs will be discussed more later on, but you can at least see how the overproduction of thyroid hormone is what is causing them to happen in the first place.
So causative and risk factors for hyperthyroidism. First, causative factors. Most common is Graves' disease, which is when the body produces antibodies that bind to the cells on the thyroid, causing the thyroid to secrete more hormones. Second is a goiter, which is nodules or lumps on the thyroid, causing an increase in thyroid hormones. Third is thyroiditis, which is an inflamed thyroid, and there are two different types. The first type is postpartum, which is after birth. There's an increase in thyroid hormones, and second is when there's an infection, trauma, or stress to the thyroid or an exposure to radiation. Next is medication-induced, and that happens when you're taking too much prescribed thyroid hormones or some over-the-counter energy or diet supplements causes increase as well. Next is iodine, and exposure to iodine or taking too much of an iodine supplement can also cause an increase. And Hashimoto's disease. With this disease, there can be a period of time where there is too much thyroid hormone before there is too little because of the disease process destruction. Next is hyperemesis gravidarum, which is when the disease causes nausea and vomiting, and women have a slightly higher thyroid hormone levels with this disease. Next is pituitary-induced. The pituitary is the main gland that secretes hormone to cause other glands to secrete hormones like our thyroid, and that can be caused by a tumor or a gene mutation. Next is fetal neonatal, and this is caused by the mother having Graves' disease or a history of Graves' disease and passing it down to the fetus. And lastly is genetic. Genetics can play a role in the development of Graves' disease, which increases your chance of getting it. Next is risk factors. Women are more likely to get hyperthyroidism due to reproductive reasons. Next is a history of autoimmune diseases, which is when the body attacks itself. So examples of this is rheumatoid arthritis, lupus, and celiac disease. And next is a history of thyroid diseases, and things like this can be like thyroid nodules. Another risk factor is recently being pregnant, and this can cause you to get the postpartum thyroiditis. Other risk factors are smoking, iodine intake increased, trauma to the thyroid, vitamin D deficient, and lastly psychological stress, which can be loss of a partner or a divorce.
Some signs and symptoms of hyperthyroidism. So in elders, it is actually common to not see any of the symptoms associated with this condition. In those that we do see presenting with the symptoms, we'll see nervousness or anxiety. Relating to that, we'll see an increased resting heart rate. This can cause heart palpitations, feeling like the heart's fluttering inside your chest. A heat intolerance with increased sweating is also common. Tremors, weight loss, associated with an increased appetite or excessive weight loss without trying to lose weight. Frequent bowel movements. A lump in the neck is also common. This can be the actual thyroid gland itself being swollen. Thin, delicate skin, and in severe hyperthyroidism cases, we will see a mental status change. So some of the diagnostic tests and lab tests that we can do to see if someone does have this condition, the most common one would be a blood test. We'll be measuring the levels of the actual thyroid hormones, T4 and T3 themselves. In hyperthyroidism, you'll see that these two levels are elevated. The other thyroid hormone, the thyroid stimulating hormone, will also be measured, and in hyperthyroidism, you'll see a low TSH. Two other ones that are also commonly used are iodine uptake scan. This one requires clients to ingest a small amount of radioactive iodine, and then the amount that is found in the thyroid versus the amount that is excreted through the body is measured, and it's determined by how much iodine the gland takes up. Thyroid scan is usually simultaneously done with the iodine test, and patients also take that radioactive iodine. The thyroid scans use the emissions of gamma rays from the radioactive iodine to obtain a picture of the thyroid. And this test is similar to an X-ray using the same mechanics of imaging of that. And those are the three main tests that you'll see used for the diagnosis of hyperthyroidism.
The nurse will educate you on the importance of nutrition and instruct you to avoid foods that contain iodine, such as kelp and seaweed. The nurse will also advise you to stay away from stimulants such as coffee, soft drinks, energy drinks, and cigarettes, because they can further increase your heart rate. The nurse will provide you with a cool environment and access to a fan to ensure that you are comfortable through your symptoms of hypothyroidism and not too warm. The nurse will assess how much fluid you are taking in and out, and take daily weights and look for signs of edema or fluid buildup. A medical intervention that's commonly used for hypothyroidism is to be prescribed a medication. One medication that will be prescribed is an antithyroid medication. Antithyroid medications work over time by preventing your thyroid gland from producing excess amounts of the thyroid hormones. Another medication that can be used are beta blockers. Beta blockers are traditionally used to treat high blood pressure and doesn't directly affect the thyroid gland. However, it will reduce many symptoms such as sweating and rapid heartbeat.
We hope this was helpful to you as a woman to learn about the disease process, the cause and risk factors, the signs and symptoms, the diagnostic tests, and the nursing interventions that go along with hyperthyroidism.